So here at RMA of New York, we treat a significant number of patients, international patients that come to see us because of our expertise in human embryology to do cycles of treatment of in vitro fertilization. I would say that at the present time we treat more than 250 to 300 patients a year. The way we manage these patients is by initially have them complete the quality control checklist and all the tests that are necessary in their home country. Then we essentially, once we start the treatment cycle, we have them monitor initially in their country. Typically, we find reproductive endocrinologists or infertility specialists that help us with initial monitoring, which means essentially doing some blood tests and doing some ultrasounds to measure follicles at the beginning of the stimulation phase. Patients fly to New York. Essentially, we complete here in New York the stimulation protocols. We complete in New York the stimulation phase. We get those eggs to full maturity, and patients are here in New York for the retrieval or the harvesting of the eggs, as well as all the embryological work, which takes place essentially over 5 days until the time of the transfer of patients. In general, the second phase of the process, which is really the embryological work, that all gets done here in our lab, New York City, regardless of where the patients come from. That is a 5-day or 6-day period of time in which our embryologists work with the zygotes and with the developing embryos to make sure that we have embryos of good quality for the transfer. 9 to 10 days generally after the transfer is done, we test for pregnancy, and pregnancy tests are done generally back wherever they came from. We identify a lab that can measure the beta HCG, which is the pregnancy test, and basically get it done. Ultimately, once pregnancies are achieved, we monitor, or we help them monitor pregnancies for the first 2 to 3 weeks and ultimately make the transition for them to go back to their obstetricians.